The morning sun cast long shadows across the sterile corridors of St. Margaret's Medical Center as Sarah Chen adjusted her crisp white uniform for what would be her third day as a surgical nurse. At 26, she carried herself with quiet confidence, though her hands still trembled slightly when she thought about the complexity of the cases she might face. The hospital had a reputation for handling the most challenging surgeries in the region, and Sarah knew she was fortunate to have landed a position here straight out of nursing school. Dr. Marcus Hartwell's name was whispered with reverence throughout the hospital halls. At 52, he had performed over 3,000 successful surgeries and was considered one of the finest cardiovascular surgeons on the East Coast. His precision was legendary, his dedication unquestionable, and his success rate nearly perfect. Patients traveled from across the country seeking his expertise, and medical students competed fiercely for the chance to observe his procedures. Sarah had heard the stories about Dr. Hartwell's intensity in the operating room. Nurses spoke of his unwavering focus, his ability to remain calm under the most extreme pressure, and his habit of working in complete silence when performing the most delicate aspects of surgery. Some found his demeanor intimidating, but Sarah respected the level of concentration required for his work. The day began like any other in the cardiac unit. Sarah reviewed her assignments and prepared the instruments for the morning's first surgery. Mrs. Eleanor Rodriguez, a 68-year-old grandmother, was scheduled for a complex heart valve replacement. The procedure was routine for someone of Dr. Hartwell's caliber, but Sarah understood that for Mrs. Rodriguez and her family waiting anxiously in the corridor, it represented everything. Mrs. Rodriguez had been experiencing increasing shortness of breath for months. Her condition had deteriorated to the point where she could barely walk from her bedroom to the kitchen without stopping to rest. Her 3 grandchildren, aged 8 to 14, had watched their vibrant grandmother slowly lose her strength. The surgery offered hope for many more years of birthday parties, school plays, and family gatherings. As Sarah entered the preoperative area, she found Mrs. Rodriguez looking surprisingly calm. The older woman smiled warmly and reached out to squeeze Sarah's hand. "You have kind eyes," she said softly in accented English. "I can tell you care about your patients." Sarah was touched by the gesture and spent a few extra minutes ensuring Mrs. Rodriguez felt comfortable and understood the procedure ahead. The operating room buzzed with its usual pre-surgery activity. The anesthesiology team prepared their equipment while surgical technicians arranged instruments with military precision. Dr. Hartwell entered wearing his characteristic focused expression, nodding briefly to acknowledge the team before beginning his ritual of reviewing the patient's charts one final time. Sarah had assisted with dozens of surgeries during her training, but she had never worked directly with Dr. Hartwell. She watched as he methodically scrubbed his hands, each movement deliberate and practiced. The ritual seemed almost meditative, and Sarah found herself matching his careful attention to detail as she double-checked her own preparations. Mrs. Rodriguez was wheeled into the operating room, and the anesthesia took effect quickly. Dr. Hartwell began the procedure with his usual steady confidence. The initial incision was perfect, and Sarah marveled at the surgeon's precise movements. Every cut, every suture, every decision seemed effortless, the result of decades of experience and thousands of hours of practice. For the first hour, everything proceeded exactly as planned. Dr. Hartwell worked with minimal conversation, communicating primarily through subtle gestures that his experienced team understood perfectly. Sarah found herself anticipating his needs, passing instruments before he asked and maintaining the sterile field with careful attention. The heart valve replacement required exposing Mrs. Rodriguez's heart and temporarily stopping its function while a heart-lung machine maintained circulation. This was always the most critical phase of the surgery, demanding absolute precision and timing. Dr. Hartwell had performed this procedure hundreds of times, but Sarah could feel the heightened tension that always accompanied this moment. As Dr. Hartwell began the delicate work of removing the damaged valve, something unexpected happened. His hands, which had moved with such certainty for the past hour, suddenly became still. The surgeon stood frozen over the open chest, his breathing shallow and rapid. Seconds passed, then a minute, with no movement or instruction. The surgical technician looked confused, glancing between Dr. Hartwell and the patient monitors. the anesthesiologist noticed the unusual pause and looked up from his equipment. The entire room seemed suspended in an unnatural silence, broken only by the steady beeping of the heart monitor and the mechanical sounds of the heart-lung machine. Sarah watched Dr. Hartwell's face and recognized something she had learned to identify during her training: the signs of someone experiencing a medical emergency. His color had changed slightly, and there was a distant look in his eyes that suggested he was not fully present. She had seen similar symptoms during her rotation in the emergency department when patients experienced sudden neurological events. The other team members seemed uncertain how to respond. Dr. Hartwell's reputation for intense concentration made them hesitant to interrupt what might simply be a moment of deep focus. But Sarah's training in emergency medicine told her this was something more serious. She had spent months learning to recognize the subtle signs of strokes, seizures, and other medical crises. Minutes continued to pass with no movement from the lead surgeon. Mrs. Rodriguez lay open on the table, her life maintained by machines while her heart remained exposed and vulnerable. The critical window for completing the valve replacement was narrowing, and every moment of delay increased the risk of complications. Sarah felt her own heart racing as she processed the gravity of the situation. A patient's life hung in the balance, and the surgeon who was supposed to save her appeared to be experiencing some kind of medical episode. The other team members looked to Dr. Hartwell for guidance, but he remained motionless, his eyes unfocused and his breathing irregular. The weight of the moment pressed down on everyone in the room. This was not a situation covered in any textbook or training manual. How do you handle the medical emergency of your surgeon in the middle of a life-saving operation? The protocols for patient emergencies were clear, but what happens when the person trained to save lives becomes unable to function? Sarah realized that someone needed to take action, but the hierarchy of the operating room was rigid and well-established. As the newest and least experienced member of the team, she was expected to follow orders, not give them. Yet her training had also taught her that patient safety always came first, regardless of protocol or hierarchy. The monitors continued their steady rhythm, but Sarah knew that time was running out. Mrs. Rodriguez's condition was stable for now, but the longer the surgery remained incomplete, the greater the risk of complications. The heart-lung machine could only maintain circulation for a limited time, and the open chest cavity remained vulnerable to infection and other complications. Looking around the room, Sarah saw uncertainty and fear in her colleagues' faces. They were all skilled professionals, but this situation was unprecedented. The surgical technician had assisted Dr. Hartwell for years but had never been trained to complete a surgery independently. The anesthesiologist focused on maintaining Mrs. Rodriguez's stable condition but could not leave his post to address Dr. Hartwell's apparent medical crisis. Sarah took a deep breath and stepped closer to Dr. Hartwell. "Doctor," she said quietly, "are you feeling all right?" There was no response. His eyes remained unfocused, and his hands stayed frozen in position above the patient. She repeated her question, slightly louder this time, but again received no acknowledgement. The reality of the situation became clear: Dr. Hartwell was experiencing some kind of medical emergency, and Mrs. Rodriguez's surgery hung in the balance. Someone would need to make critical decisions about how to proceed, and time was running out to save both the patient on the table and, potentially, the surgeon who had dedicated his life to saving others. Sarah felt the weight of her limited experience, but she also remembered the words of her favorite instructor: when protocols fail and situations become unprecedented, trust your training and put the patient first. She looked at Mrs. Rodriguez's peaceful face and thought of the grandchildren waiting for their grandmother to come home. The next few moments would determine not only Mrs. Rodriguez's fate but would test everything Sarah had learned about medicine, leadership, and the courage required to act when others cannot. The operating room that had been filled with confident routine just minutes earlier had become a place where split-second decisions would determine whether two lives could be saved. As Sarah processed the unprecedented situation unfolding before her, she realized that her 3 days of experience at St. Margaret's had not prepared her for this moment. Yet somewhere in her training, in the countless hours of study and practice, lay the knowledge and skills that might be needed to navigate this crisis. The question was whether she would have the courage to act on them. Sarah's mind raced as she assessed the critical situation developing in operating room 3. Dr. Hartwell remained motionless, his breathing shallow and his complexion pale. The experienced surgical team looked to one another with growing concern, but years of rigid hierarchy kept them from taking immediate action. Sarah realized that protocol was failing them when it was needed most. Drawing on her emergency medicine training, Sarah moved closer to Dr. Hartwell and gently touched his shoulder. "Dr. Hartwell, can you hear me?" she asked in a clear, steady voice. When he failed to respond, she quickly checked his pulse at his wrist. It was rapid and irregular, confirming her suspicion that he was experiencing a serious medical event. "I believe Dr. Hartwell is having a medical emergency," Sarah announced to the room, her voice cutting through the tense silence. "We need to call for immediate medical assistance while maintaining our patient's care." The surgical technician, Tom Morrison, who had worked with Dr. Hartwell for over a decade, looked stunned. He had never seen anything like this happen to the surgeon he considered nearly invincible. Dr. Jennifer Patel, the anesthesiologist, immediately understood the gravity of the situation. "I'll call for the emergency response team," she said, reaching for the phone while keeping one eye on Mrs. Rodriguez's monitors. "Sarah, what are you thinking in terms of Dr. Hartwell's condition?" "Given his symptoms and sudden onset, I suspect he may be experiencing a transient ischemic attack or possibly a small stroke," Sarah replied, her training taking over despite her nervousness. "He needs immediate neurological assessment, but right now our primary concern has to be Mrs. Rodriguez. Her heart valve replacement is only partially complete." Tom looked between the motionless surgeon and the open patient. "What do we do? Dr. Hartwell is the only one here qualified to complete this surgery. Should we close her up and transfer to another hospital?" The suggestion hung heavy in the air. They all knew that closing the patient without completing the valve replacement would likely be fatal, and transferring during such a critical phase was extremely risky. Sarah's mind flashed back to her final year of nursing school when she had spent 3 months in an advanced surgical program. Unlike most nursing students who focused primarily on postoperative care, Sarah had been fascinated by the surgical procedures themselves. She had spent countless hours studying surgical techniques, watching procedures, and even practicing suturing on training models. Her instructor, Dr. Rebecca Martinez, had been a retired surgeon who believed nurses should understand every aspect of patient care. "You never know when you might be the only one available to make a life-saving decision," Dr. Martinez had often said. "The more you understand about the entire process, the better you can serve your patients." During that rotation, Sarah had assisted with several heart valve replacements and had even been allowed to perform some of the less critical suturing under close supervision. Dr. Martinez had been impressed with Sarah's steady hands and natural understanding of the procedures. "You have surgeon's hands," she had told Sarah. "If you ever consider changing your career path, you should think about medical school." Now, as Sarah looked at Mrs. Rodriguez's exposed heart and the partially removed valve, those months of training suddenly seemed more valuable than ever. She had watched this exact procedure dozens of times and had even practiced the basic techniques on simulation models. While she was far from qualified to perform surgery independently, she understood the steps required to complete the valve replacement. "I need to tell you all something," Sarah said, her voice steady despite her racing heart. "I have more surgical training than most nurses. I spent 3 months in an advanced surgical program, and I've assisted with valve replacements before. I'm not suggesting I'm qualified to perform surgery, but I might be able to help us navigate this situation until we can get another surgeon here." Dr. Patel looked up from her equipment. "The emergency team is on their way for Dr. Hartwell, but I've also called Dr. Sarah Kim from cardiology. She's in surgery in or two, but they estimate it will be at least 45 minutes before she can get here. Mrs. Rodriguez can't wait that long." Tom studied Sarah with new interest. "What exactly are you suggesting? You understand this could end both our careers if something goes wrong?" His voice carried both fear and a desperate hope that someone might have a solution to their impossible situation. "I'm suggesting that I talk you through completing the valve replacement while I assist," Sarah replied carefully. "Tom, you've been Dr. Hartwell's lead technician for 10 years.
You know these procedures better than anyone. Between your experience and my surgical training, we might be able to keep Mrs. Rodriguez stable until Dr. Kim arrives. The weight of the decision pressed down on everyone in the room. They were essentially being asked to perform surgery without a licensed surgeon present, relying on a technician's experience and a nurse's limited training. It went against every protocol and regulation they knew, but the alternative was watching Mrs. Rodriguez die on the table. Dr. Patel spoke first. From an anesthesia standpoint, Mrs. Rodriguez is stable. Her vital signs are good, and I can maintain her condition for at least another hour if needed. But, you're talking about performing major surgery without proper credentials. The legal and ethical implications are enormous. Sarah understood the risks, but she also remembered Mrs. Rodriguez's warm smile and the trust in her eyes. I know this is unprecedented, but sometimes unprecedented situations require unprecedented responses. Tom knows every movement Dr. Hartwell makes in these surgeries. I understand the anatomy and the procedure. Together, we might be able to save her life. Tom took a deep breath and looked at the monitors showing Mrs. Rodriguez's steady vital signs. Dr. Hartwell always says that patient care comes first, no matter what. If we don't do something, she's going to die. If we try and fail, she might die, but at least we tried. He paused, then nodded slowly. What do you need me to do? Sarah felt a mixture of terror and determination as she realized they were actually going to attempt this. First, let's stabilize Dr. Hartwell. The emergency team should be here any moment. As if summoned by her words, the door burst open and 2 emergency medical technicians rushed in, followed by Dr. Andrew Chun from the emergency department. What's the situation? Dr. Chun asked quickly, immediately moving to assess Dr. Hartwell while the EMTs prepared their equipment. Sarah briefed him on Dr. Hartwell's symptoms and the timeline of events. Dr. Chen's examination confirmed her suspicion of a possible neurological event. We need to get him to the ER immediately, Dr. Chen announced. But what about your patient here? Sarah quickly explained their plan, and Dr. Chen's expression showed both concern and admiration. That's incredibly risky, but given the circumstances, it might be the only option. I'll document that this was an emergency situation with no alternatives available. As the emergency team carefully moved Dr. Hartwell from the operating room, Sarah felt the full weight of responsibility settle on her shoulders. Mrs. Rodriguez's life now depended on her ability to guide Tom through a procedure she had only watched and practiced in training scenarios. Okay, Tom, Sarah said, moving to the position Dr. Hartwell had occupied. Let's review where we are in the procedure. The damaged valve has been partially removed, but we still need to complete the removal and install the new valve. Dr. Patel, how much time do we have before the heart-lung machine becomes a concern? I'd prefer to have her heart functioning on its own within the next 30 minutes, Dr. Patel replied. After that, we start risking complications from prolonged bypass time. Sarah examined the surgical site carefully, drawing on every detail she had memorized from her training. The anatomy was exactly as she had studied, and she could visualize the steps needed to complete the procedure. Tom, I need you to hand me the same instruments Dr. Hartwell was using. We're going to take this one step at a time. As Sarah began to guide Tom through the next phase of the surgery, she felt her training taking over. The months of practice, the hours of observation, and the careful instruction from Dr. Martinez all came together. Her hands moved with surprising steadiness as she helped complete the valve removal. The removal is complete, she announced, feeling a surge of confidence. Now we need to prepare the new valve for installation. Tom, you've seen Dr. Hartwell do this dozens of times. Trust your memory and your instincts. The next 20 minutes would determine whether their desperate plan could succeed. Sarah knew they were operating in uncharted territory, but Mrs. Rodriguez's steady vital signs gave her hope that they might actually be able to save her life. The operating room that had been filled with uncertainty just an hour earlier was now functioning with a different kind of energy, driven by determination and teamwork rather than traditional hierarchy.
As they worked together, Sarah realized that this moment was testing everything she believed about medicine, teamwork, and the courage required to act when conventional solutions fail. The outcome would either vindicate their decision or become a cautionary tale about the dangers of exceeding one's training. Either way, she knew they were giving Mrs. Rodriguez the best chance she had. The new heart valve gleamed under the bright operating room lights as Sarah carefully examined it before installation. Her hands, surprisingly steady despite the enormous pressure, moved with the precision she had developed through months of intensive training. Tom Morrison watched her every movement, ready to assist with the instruments he knew so well from years of working alongside Dr. Hartwell. "The valve preparation looks perfect," Dr. Patel observed from her position at the anesthesia station. Mrs. Rodriguez's vital signs remained stable, but were approaching the 20-minute mark on the bypass machine. "We need to maintain our pace." Her voice carried both encouragement and urgency, reminding everyone of the critical timing involved. Sarah nodded, feeling the weight of responsibility but drawing strength from her team's support. She had never imagined that her advanced surgical training would be put to such an extreme test, but the countless hours of practice and observation were serving her well. "Tom, I need you to position the valve exactly as you've seen Dr. Hartwell do. Your muscle memory from assisting him is going to be crucial here." As Tom carefully maneuvered the valve into position, Sarah guided him through the precise placement that was critical to the surgery's success. The valve had to be positioned perfectly to ensure proper blood flow and prevent leakage. One small error could result in complications that would require additional surgery or could even be fatal. "Remember, the valve needs to align with the natural anatomy of her heart," Sarah instructed, recalling the detailed diagrams she had memorized during her training. Dr. Martinez always taught us that the valve should sit naturally in the space, not forced or manipulated. Her instructor's voice seemed to echo in her mind, providing guidance even in this unprecedented situation. The first sutures were the most critical, establishing the foundation for the entire valve attachment. Sarah's hands moved with careful deliberation, each stitch placed with the precision she had practiced hundreds of times on training models. Tom anticipated her needs perfectly, having watched this exact sequence countless times with Dr. Hartwell. "Excellent placement," Dr. Patel commented as she monitored Mrs. Rodriguez's response to the procedure. "Her heart rhythm is stable, and all indicators suggest she's tolerating the surgery well. You're both doing incredibly well under these circumstances." As they continued with the valve installation, Sarah found herself drawing on not just her technical training but also the confidence that came from truly understanding the purpose behind each step. This wasn't just about following a procedure, it was about restoring Mrs. Rodriguez's heart function so she could return to her grandchildren and the life she loved. Halfway through the valve attachment, the operating room door opened, and Dr. Sarah Kim from cardiology entered with 2 additional nurses. She had finished her previous surgery ahead of schedule and rushed to assist with the emergency situation. Her arrival brought both relief and new tension to the room. "I came as quickly as I could," Dr. Kim announced, immediately moving to scrub in. "I'd been briefed on the situation. How are we progressing?" Her reputation as an excellent surgeon was well known throughout the hospital, and her presence provided the professional backup the team desperately needed. Sarah felt a moment of uncertainty as she realized she would need to transfer control of the surgery to Dr. Kim. Part of her wanted to continue, feeling confident in the progress they had made, but she understood the importance of having a licensed surgeon complete the procedure. "We've successfully installed the valve and completed about 60% of the suturing," Sarah reported professionally. "Mrs. Rodriguez has remained stable throughout, and the valve positioning appears optimal. Tom has been invaluable in maintaining Dr. Hartwell's standards of precision." Dr. Kim examined the surgical site carefully, her experienced eye assessing every aspect of the work that had been completed. After a thorough review, she looked up with an expression of genuine admiration. "This is exceptional work. The valve placement is perfect, and the suturing quality matches what I would expect from an experienced surgeon. How did you achieve this level of precision?" Sarah briefly explained her advanced surgical training and the collaboration with Tom's extensive experience. Dr. Kim listened intently, nodding as she understood how the team had managed to maintain such high standards under extraordinary circumstances. "I'd like you to continue with my supervision," Dr. Kim said, surprising everyone in the room. "You've established an excellent foundation, and maintaining continuity might be best for the patient. I'll guide you through the remaining steps and take responsibility for the overall procedure." The offer was both flattering and terrifying. Sarah had proven she could handle the technical aspects of the surgery, but completing the entire procedure would push her far beyond anything she had ever imagined doing. Yet Mrs. Rodriguez's stable condition and the quality of work they had achieved gave her confidence that they could succeed. "I accept, with gratitude for your supervision," Sarah replied, feeling both honored and nervous. Tom smiled broadly, clearly pleased that their partnership would continue under Dr. Kim's expert guidance. Dr. Patel nodded approvingly from her position, having witnessed the entire team's remarkable performance. Under Dr. Kim's careful supervision, Sarah completed the remaining sutures with growing confidence. Each stitch was reviewed and approved, ensuring that the highest standards were maintained. The collaborative approach allowed Sarah to continue developing her skills while ensuring patient safety. "Now comes the moment of truth," Dr. Kim announced as they prepared to remove Mrs. Rodriguez from the heart-lung machine and allow her heart to resume its normal function. "This is when we discover whether our valve installation has been successful." The team watched the monitors intently as Mrs. Rodriguez's heart was gradually allowed to take over circulation. The first few beats showed some irregularity, which was normal after such a procedure, but then, the rhythm stabilized into a strong, steady pattern. The valve function appeared perfect, with no signs of leakage or obstruction. "Outstanding results," Dr. Kim declared with obvious satisfaction. "The valve is functioning beautifully, and her heart rhythm is better than we could have hoped for. Mrs. Rodriguez is going to have an excellent outcome from this surgery." As they began the closing procedures, Sarah reflected on the incredible journey of the past 2 hours. What had started as a routine surgery with an experienced surgeon had transformed into an unprecedented emergency that tested everyone's skills and courage. The collaboration between team members from different backgrounds and experience levels had created something remarkable. Tom's expertise with instruments and procedures had been invaluable, proving that experienced technicians possess knowledge that goes far beyond their formal job descriptions. Dr. Patel's steady management of anesthesia and patient monitoring had provided the stable foundation that made everything else possible. Dr. Kim's willingness to supervise rather than simply take over had shown true leadership and recognition of effective teamwork. "Sarah, I want you to know that what you accomplished here today was extraordinary," Dr. Kim said as they completed the final sutures. "Your combination of technical skill, clinical judgment, and leadership under pressure is remarkable. Have you ever considered pursuing surgical training?" The question caught Sarah by surprise, though it echoed similar suggestions from Dr. Martinez during her advanced training. "I've always been fascinated by surgery, but I never thought I had the background or opportunity to pursue it seriously," she admitted. "After today, I think you should reconsider that assumption," Dr. Kim replied. "I'd be happy to discuss the possibility of surgical residency programs that might be interested in someone with your demonstrated abilities. The medical field needs surgeons who can think creatively and work effectively under pressure." As Mrs. Rodriguez was prepared for transfer to the recovery room, Sarah felt a profound sense of accomplishment mixed with gratitude for the trust her team had placed in her. They had faced an impossible situation and found a way to succeed through collaboration, determination, and willingness to exceed traditional boundaries. The operating room that had been filled with crisis just hours earlier was now returning to its normal rhythm. Equipment was being cleaned and reorganized, instruments were being sterilized for the next surgery, and the team was preparing to resume their regular schedules. Yet everyone knew that something significant had changed. Word of the successful surgery was already spreading through the hospital corridors. The story of how a new nurse had stepped up to save a patient's life when the surgeon became incapacitated was becoming legendary. More importantly, Mrs. Rodriguez was stable and on her way to a full recovery. As Sarah finally left the operating room, she thought about Mrs. Rodriguez's grandchildren who would soon be able to hug their grandmother again. The warm smile and kind words from earlier that morning had motivated her to fight for this patient's life, and the outcome had exceeded everyone's expectations. The day that had begun as just another shift in her new job had become a turning point that would influence the rest of her career. Sarah realized that sometimes the most important moments in life come not from careful planning but from the courage to act when circumstances demand it. 3 hours after the surgery, Sarah sat in the recovery room beside Mrs. Rodriguez, who was slowly awakening from anesthesia. The monitors showed stable vital signs, and the new heart valve was functioning perfectly. Sarah had volunteered to stay beyond her shift to ensure her patient's smooth transition from surgery, feeling a personal connection that went far beyond professional duty. "Nurse Sarah," Mrs. Rodriguez whispered weakly as her eyes fluttered open.
Did everything go well?
Her voice was hoarse from the breathing tube, but the concern in her eyes was for others rather than herself.
"I hope Dr. Hartwell is okay. He seemed like such a dedicated doctor." Sarah squeezed the older woman's hand gently.
"Your surgery was completely successful, Mrs. Rodriguez. Your new heart valve is working beautifully, and you're going to feel much better in the coming weeks.
Dr. Hartwell is receiving excellent care, and his condition is stable." She chose not to burden her patient with the details of the extraordinary circumstances surrounding her surgery.
Mrs. Rodriguez smiled weakly but with genuine warmth.
"I can already feel the difference in my breathing. It's like someone opened a window in my chest." Her observation was more accurate than she realized. The new valve was already improving her heart's efficiency dramatically.
In the corridor outside, Sarah's colleagues were still discussing the unprecedented events of the morning. Word had spread throughout the hospital about the successful surgery, and reactions ranged from amazement to concern about the protocols that had been bypassed. Hospital administration was conducting meetings to review the incident and determine appropriate responses. Dr. Kim found Sarah in the recovery room and requested a private conversation. They walked to a quiet conference room where Dr. Kim's expression was serious but not disapproving. "Sarah, I've spent the afternoon reviewing what happened today and discussing the situation with hospital administration. I want you to understand both the significance of what you accomplished and the complexity of the situation we're all facing." Sarah felt her stomach tighten, wondering if she was about to face disciplinary action despite the successful outcome. "I understand that we operated outside normal protocols, Dr. Kim. I hope the administration recognizes that we were facing an impossible situation with no good alternatives."
"That's exactly what I've been explaining to them," Dr. Kim replied reassuringly. "Your actions today saved Mrs. Rodriguez's life when conventional approaches would have failed. However, we need to address the larger implications of what happened and ensure that proper procedures are in place for any similar future emergencies."
The conversation was interrupted by Tom Morrison, who knocked on the door and asked to join them. His usually confident demeanor showed signs of stress as he sat down. "I've been thinking about today all afternoon, and I want to make sure I didn't put anyone in jeopardy by agreeing to assist with the surgery." Dr. Kim addressed both of them directly. "I want you both to understand that your actions today were heroic, but they also raise important questions about how we handle emergency situations. The hospital administration is not looking to assign blame, they're trying to learn from what happened and improve our emergency protocols." Sarah appreciated Dr. Kim's support but remained concerned about the long-term consequences.
"Are there going to be formal investigations?"
"I'm worried about how this might affect Tom's career, especially since he was following my suggestions rather than established protocols." "The initial review has been very positive," Dr. Kim explained. "The key factors in your favor are the emergency nature of the situation, the lack of alternatives, the successful outcome, and the fact that proper supervision was established as soon as possible. Dr. Chen from Emergency Medicine has documented that this was a life-threatening emergency with no conventional solutions available."
Tom looked relieved but still concerned. "What about our licenses and certifications?
I know I exceeded my scope of practice, even though it was to save a patient's life." His question reflected the same worry that had been troubling Sarah since the surgery ended. "The hospital's legal team and the state medical board have been consulted," Dr. Kim continued. "Given the emergency circumstances and successful outcome, they're treating this as a case study for emergency protocol development rather than a disciplinary matter. Your actions are being viewed as examples of medical professionals putting patient welfare first in an unprecedented situation. Relief flooded through Sarah, but she remained curious about the broader implications.
Will this change how the hospital handles similar emergencies in the future?
The question reflected her growing interest in healthcare systems and emergency preparedness.
Absolutely, Dr. Kim confirmed.
We're developing new protocols for surgeon incapacitation during surgery, including immediate backup procedures and expanded training for surgical technicians and nurses. Your experience today has highlighted gaps in our emergency preparedness that we hadn't previously considered. The conversation was interrupted by a nurse from the emergency department who brought an update on Dr. Hartwell's condition. He had experienced a transient ischemic attack, essentially a minor stroke, but was responding well to treatment. His prognosis was excellent, and he was expected to make a full recovery within a few weeks. Dr. Hartwell specifically asked about Mrs. Rodriguez and the surgical team, the nurse reported. When he learned about the successful surgery, he asked to speak with everyone involved as soon as his doctors approved visits. The news brought smiles to everyone's faces, knowing that both patients from the morning's crisis would recover fully. Dr. Kim returned to her earlier suggestion about Sarah's future career path. I've spoken with several colleagues about your performance today, and there's unanimous agreement that you should seriously consider surgical training. Your combination of technical skills, decision-making ability, and leadership under pressure is exactly what we look for in surgical candidates. Sarah had been thinking about this possibility throughout the afternoon, but the suggestion still felt surreal. I'm honored by the recommendation, Dr. Kim, but surgical residency requires years of additional training and a completely different career path.
I'm not sure I'm prepared for such a dramatic change.
I understand your hesitation, Dr. Kim replied, but I want you to know that several attending surgeons are willing to provide recommendations and mentorship if you decide to pursue this path.
Today proved that you have natural surgical instincts that can't be taught.
The technical skills can be learned, but the judgment and composure you displayed are innate. Tom added his perspective to the conversation. Sarah, I've worked with dozens of surgeons over the years, and what you did today was extraordinary. Your respect for the patient, attention to detail, and ability to collaborate effectively are exactly what medicine needs. You should definitely consider Dr. Kim's suggestion. The discussion was interrupted by Mrs. Rodriguez's daughter, Maria, who had arrived from across the state after receiving news of her mother's surgery. She was looking for Sarah specifically, having heard from other family members about the nurse who had played such a crucial role in saving her mother's life.
Are you Sarah?
Maria asked, her eyes filled with tears of gratitude.
My family wants to thank you for what you did for my mother today.
We don't completely understand all the medical details, but we know you went above and beyond to save her life. Sarah felt emotional as she accepted Maria's thanks, thinking about how different this conversation might have been if their desperate plan had failed. Your mother is a wonderful woman, and she's going to do very well. The most important thing is that she'll be able to spend many more years with her grandchildren. Maria wiped away tears as she continued.
My kids have been so worried about their grandmother.
They've watched her getting weaker and weaker, and they were afraid she might not survive the surgery.
Knowing that she's going to be okay means everything to our family.
As the afternoon progressed, Sarah realized that her life had fundamentally changed in the span of a few hours. The confidence she had gained from successfully navigating the crisis, the recognition from her colleagues, and the gratitude of Mrs. Rodriguez's family had transformed her self-perception. She was no longer just a new nurse trying to find her place in the hospital, she had proven herself capable of extraordinary things when circumstances demanded them. The story of the surgery was already becoming part of hospital legend, but, more importantly, it had opened doors for Sarah's future that she had never imagined possible. Dr. Kim's offer of mentorship for surgical training represented an opportunity that few nurses ever receive, especially so early in their careers. That evening, as Sarah finally prepared to leave the hospital after her extended shift, she stopped by Mrs. Rodriguez's room one more time. The patient was awakened, chatting quietly with her daughter about plans for recovery and future visits with the grandchildren. The improvement in her breathing and energy was already noticeable. "Thank you again, dear," Mrs. Rodriguez said as Sarah checked on her. "I don't know exactly what happened during my surgery, but I know you took excellent care of me. I hope our paths cross again under happier circumstances." Sarah smiled and promised to visit during Mrs. Rodriguez's recovery. As she walked through the hospital corridors toward the exit, she reflected on the extraordinary day and the choices that lay ahead. The young woman who had entered the operating room that morning as a nervous new nurse was leaving as someone who had proven capable of rising to meet unprecedented challenges. The decision about pursuing surgical training would require careful consideration, but Sarah knew that whatever path she chose, she would always remember the day when protocol failed and teamwork succeeded, when a patient's life hung in the balance and ordinary people found the courage to do extraordinary things. Mrs. Rodriguez would return to her grandchildren, Dr. Hartwell would recover from his medical episode, and Sarah had discovered capabilities within herself that would shape the rest of her career in medicine. The operating room where everything had begun that morning was being prepared for the next day's surgeries, but the lessons learned and relationships forged during those critical hours would influence St. Margaret's Medical Center for years to come. Sometimes the most important changes in healthcare come not from new technology or procedures, but from the courage of individuals willing to exceed their limitations when patients' lives depend on it.